Today, we're unpacking a really critical needs assessment that digs into a huge, incredibly expensive, and, get this, an entirely solvable problem that's happening right now in Delaware. $162 million. Just let that number sink in for a second. And this isn't some one-time expense. We're talking about an annual bill. So what is this for? Well, that's the yearly medical price tag for falls among Delaware's older adults. Falls that are largely preventable. We're going to follow the money here and figure out why this is happening, and more importantly, why it really doesn't have to. And here's the breakdown of who's paying. It turns out the public is footing most of the bill. Yep, over 70% of that massive cost is paid by taxpayers through Medicare. That's $108 million, and Delaware's own Medicaid program, which chips in another $30 million. But here's the thing. This isn't just a story about falls. It's really a story about a public health failure. The direct cause of all these expensive injuries boils down to a simple, kind of shocking gap. Vulnerable people just can't get their hands on basic stuff like walkers and shower chairs that would keep them safe. So how did we even get here? Well, what's so interesting is that it's a story of two powerful forces converging at the exact same time, creating what you could call a perfect storm of need. On one side, you have what's called the silver tsunami. Delaware's population is aging, and it's aging fast. On the other side, you've got a high rate of disability, especially when it comes to mobility. Let's look at each of these. This chart here really shows that first force in action. The state's 65 and over population, it's on track to grow by 41% by 2040. But look at the 85 and older group, the people most likely to need support. Their numbers are projected to more than double. And now for that second force. You see, as people in Delaware get older, the chance of having a disability just skyrockets. For folks between 65 and 74, about 22% reported disability. But once you hit 75, that number nearly doubles to over 43%. So, you see what's happening, right? The fastest growing group of people is also the group with the highest rate of disability. These two trends aren't just adding up, they're multiplying each other. This is creating a compounding crisis, and you guessed it, an exponential demand for medical equipment. Now, this problem isn't spread evenly across the state. Not at all. The needs assessment shows that where you live in Delaware makes a huge difference in your ability to get the help you need. This table lays it all out, plain and simple. It compares the number of at-risk folks in each of Delaware's 3 counties to the number of medical equipment suppliers. And these ratios, man, they tell a story of some serious inequality. Okay, let's start with Newcastle County, which is the most urban part of the state. Here, you've got roughly 1 supplier for every 3,865 at-risk people. Let's call that our baseline. But then you move down to Kent County, and the situation gets a lot tougher. The ratio jumps to 1 supplier for every 6,736 people in need. That access gap is getting wider. And finally, in Sussex County, which, by the way, is the most rapidly aging part of the state, the ratio just explodes. You have just 1 supplier for nearly 9,500 at-risk residents. This is what the report actually calls a DME service desert. Let me put that another way for you. Somebody needing a walker in Sussex County has 2.5 times less access to a supplier than someone living just up the road in Newcastle County. It's a massive difference based on your zip code. Okay, so we've seen the staggering cost and we know the deep-seated causes. But the solution to this problem, well, this is without a doubt the most shocking part of this entire story. This timeline gets right to the heart of it. Way back in 2010, the state of Delaware created the complete legal framework for a program to solve this exact problem. And today, that program is just sitting on a shelf, completely inactive. So what did this rule do? It was simple, but it was powerful. It said that when Medicaid buys expensive equipment for someone, that equipment stays the property of the state. This basically gave Delaware the green light to get that equipment back, clean it up, and give it to the next person who needs it. And we're not talking about small stuff here. I mean, look at this list. This is the essential, life-sustaining equipment that legally became state property over a decade ago. Wheelchairs, hospital beds, walkers, patient lifts, all of it was supposed to be part of a reuse system that never got switched on. And this quote from the source report, it just hits the nail on the head. It says this isn't some new crisis that needs a brand new plan. It's a chronic, long-term problem that just requires flipping the switch on a solution the state already designed 10 years ago. It's a failure of implementation. So, if the plan's already written, what does putting it into action actually look like? Well, fortunately, Delaware doesn't have to reinvent the wheel here. Yeah, this isn't just a good idea on paper. States like Kansas and Oklahoma have already built the exact model that Delaware came up with. Their reuse programs are up and running right now, saving their states hundreds of thousands of dollars every year while getting vital equipment to people who need it. So the needs assessment lays out a really clear 3-step path forward. First, activate that dormant 2010 rule. Second, set up a smart public-private partnership to run it efficiently. And third, start the rollout in Kent and Sussex counties, where the data shows us the need is the absolute greatest. So this is where we're left. The solution was written down over a decade ago. The need is growing every single day. And the cost of doing nothing is a staggering $162 million, year after year after year. The only question left is, what is Delaware waiting for?